Hello everyone, Dr. Rush here again with another topic that I think oftentimes becomes a major issue for some women in pregnancy, and that is bleeding in early pregnancy and the causes of bleeding in early pregnancy and what can actually be done. So when we talk about bleeding in early pregnancy, we're usually talking about before the second trimester, I should say. So second trimester starts when you're approximately 13 weeks. Some women in early pregnancy do actually experience bleeding in pregnancy, and oftentimes I will say that we don't really know the cause. There are some issues that can sometimes pose risks for bleeding in early pregnancy, such as something called a subchorionic hemorrhage. The simple way of explaining that is when the placenta is starting to form, it happens as soon as the pregnancy pretty much starts, the placenta is starting to form. But you also have that placenta really establishing itself at around 9 or 10 weeks into the pregnancy. And sometimes when the connection between the vessels of what's forming as a placenta and the uterus sometimes become leaky, I guess is the best way to sort of describe it in simple terms, then there's a little bit of a bleed in between the interface between that new forming placenta and the uterus that can actually cause bleeding in pregnancy. Another cause can be postcoital bleeding, meaning bleeding after intercourse. And usually, in most cases, if women do experience bleeding after intercourse, I do typically recommend for my patients to not engage in intercourse until at least 2 weeks, until they've had no bleeding. And if it continues to happen, then that's a conversation that you need to have with your doctor as to potential causes, and also if there's something else, more serious going on, something else that can cause bleeding in early, or just bleeding in pregnancy in general outside of postcoital bleeding, can also be what's called placenta previa. And this is where the placenta is sitting over the cervical os. That's where the cervix opens and where the baby's head will eventually come out. That's what actually has to dilate to 10 centimeters in order for the baby to come out eventually. And the placenta can sit over that opening, which causes a problem. Women in those particular cases, if they have a true placenta previa, then they cannot deliver vaginally and usually have to deliver by C-section, but that too can cause bleeding in pregnancy. Usually it's something that's diagnosed probably more towards that second trimester of the pregnancy. And sometimes these what look like what could have been a placenta previa earlier in the pregnancy can sometimes resolve in that as the uterus grows, that placenta will sort of not necessarily move its way up, but it will actually sort of, as the uterus gets larger, that placenta will kind of gravitate with the growth of the uterus and come from over that cervix and sit a little bit higher in the uterus sometimes, not all the time. But the best rule of thumb here is, when in doubt, check it out. If you have bleeding in pregnancy, always good to call your doctor first. I can't say that, if it's something like a miscarriage or something of that magnitude, that there's really much that your doctor can do to help save the pregnancy, but at least they have the opportunity to be able to investigate and potentially explain why you are having bleeding. But I will say, we cannot always explain why there's bleeding, because we don't always have an explanation. But we do want to make sure that it's not something that's going to be detrimental to the patient or to the fetus, if it's something that we can potentially help. So going to triage when in fact you're having bleeding, not a bad thing to do. I always recommend that patients do call their physicians first. However, if it's something where they feel like there's a hemorrhage, there's always that possibility, and there can be doubt, just definitely check with your doctor. All right, guys, I hope this was helpful. Thanks. Bye.